Welcome friend, brother and colleague from the medical career and health professionals. Welcome to your channel Medical Consultant. Today we will talk about corneal abrasion. Previously we talked about spontaneous abortion. I will leave you the link in the description so that you can see it. If you have not seen it, without more to say, let's continue. Definition. A corneal abrasion consists of the loss of the epithelium of the corneal surface of traumatic origin. As we see in the red date, we observe in the cornea something similar to two shallow scratches. This is known as corneal abrasion. In the blue arrow, we can see a discontinuity in the corneal surface. This is called corneal abrasion. Although it hurts the corneal surface, it does not penetrate beyond it. Synonymous: corneal contusion. Epidemiology incidence represents a problem worldwide. Age distribution: it can occur at any age. Maximum incidence: in childhood, active adults and elderly and debilitated patients. Symptoms and signs. Among its symptoms and signs we have corneal turbidity, corneal surface dehiscence, conjunctival redness and infection, pain, photophobia, epiphora, foreign body sensation, ready sensation, pain when opening and closing the eyes. Etiology: direct mechanical trauma, strange bodies, contact lenses, unknown etiology. Diagnosis: differential diagnosis, acute glaucoma, herpetic ulcers into their etiology, corneal foreign body. In this image below, we can see one of the differential diagnoses of corneal abrasion, intraocular foreign bodies, which are very different things. In the little arrow that I put there we can see that splendor and we see that its surroundings are cloudy. I want us to pay attention to this, because many doctors are often confused in these diagnoses. They point out that it is abrasion, but when observing the eye with the fluorescein stain we do not find anything, and this is because sometimes tiny foreign objects are introduced to the cornea, and nothing more than a dot can be seen. Assessment: slit lamp scan, after fluorescein staining. Visual acuity examination. Intraocular pressure. Rule out the existence of a corneal laceration. Rule out other eye pathologies. Treatment. In this table we can see 4 types of treatment that in the end we will divide them into 2, one based on the pharmacology and the other on the way of treating. In those based on your pharmacology we have the non-pharmacological and the pharmacological, while the others are acute and chronic treatment. Non-pharmacological treatment: occlusion, therapeutic contact lenses, hot compresses, compressive bandage, removal of foreign bodies, pharmacotherapy, secret drugs, antibiotics, non-steroidal anti-inflammatory drugs. Acute treatment: topical antibiotics such as sulfacetamide 10% or ofloxacin/4 hours. Compressive eye bandage with closed eyelid. Secret drugs such as 5% atropine. Chronic treatment: antibiotics to prevent secondary infections. Forecast and referral: check the patient every 24 hours. And then every 3 days until the abrasion is gone and vision is restored. If the patient does not report improvement in 24 hours, he should be referred to the ophthalmologist for a more exhaustive review. Other extra considerations. Comments: never prescribe a topical anesthetic as a home treatment as it can cause corneal alterations and permanent damage. In children and adults, occlusion does not accelerate healing but can reduce the discomfort it produces. Okay, this is a clinical case. It is about a 6-year-old boy who played in the garden of his house that is limited by barbed wire. The boy did not notice, and pinned his face with the tip of one of the spikes. He made a large cut, but superficial on the face, and the cornea was lighted. When examining the eye, we observed what is seen there in the image. The child was treated with NSAIDs, antibiotics, and Etiology, did not suffer loss of vision. His diagnosis is corneal abrasion of traumatic origin. Thank you very much for your attention. The following video/topic, brain abscess. In the description, I will be leaving a link to my blog, or I will be plugging the slides that I do for my videos. Subscribe.